Hi, I'm Matt Young, CEO of Media Mice. I'm here with Professor Andre Messias to talk about a piece of technology, the RETeval ERG from LKC Technologies, that has revolutionized the way he approaches electroretinography. So, Dr. Messias, can you briefly explain how you use RETeval?
RETeval is a handheld device, so you use it as any other ERG system. So you put the electrodes on the eyes and in the skin, and you do the dark adaptation or light adaptation as you used to. You choose the protocol and you run the protocol do the recordings. So it is a basic ERG system, but it's handheld.
Before you used RETeval, you were a critic of the device. Can you explain why you believe traditional ERG was superior and why or how you changed your mind?
What you call traditional ERG is the system or the systems that you have been using so far.
Yeah.
And they have big amplifiers, they have big stimulators, they are calibrated, they have filters. So it's difficult to imagine that you can put that all development in a small machine. So that's why I'm not critical, but I just think that using the bigger machines, you can have more. You can have more features in the amplifiers and in the stimulators.
So now that you're using RETeval, how does it add value to your practice?
I realized that the RETeval can produce reliable and reproducible responses. It has limitations due to the size and the software and so on, but once you perform it correctly, it is reproducible and has reliable results.
And how does the device impact patient care and management?
The machine allows you to go where patient is. If patient is on the bed, on the theater, a surgical theater, or a child that doesn't allow you to put her in a chin rest, then you can use a handheld machine to approach the patient more easily. You can achieve a higher number of patients. You can go where the patients are.
What are some additional benefits of using the RETeval device?
RETeval has been done with skin electrodes, very fancy electrodes that you can put on the skin easily, and has normative data for these electrodes. And LKC did a nice piece of work in the software. So you have a very flexible software to program your own protocols. So you can do clinical ERG, very simple ERG, but you can also do research ERG with it.
You recently used RETeval in a study you conducted in glaucoma. You found that ERG photopic hill shows promise in the early detection of glaucoma. Could you explain a bit more?
Yeah, the photopic hill is when you don't use one single stimulus, but you use a series of increasing luminance stimulus, and then you calculate the interrelation between the stimulus intensity and the B wave amplitude. In doing so, some people have shown that some neuropathy or some disease of the optic nerve show changes in ERG or in the photopic hill. So we were interested in find if the glaucoma also showed these differences. And we indeed found that a group of early glaucoma patients have a slightly changed photopic hill responses.
Now, should ERG be done for all patients?
No, of course not. Every test that we perform, they should be done when we need them, when the doctor says it is important for his purposes. But ERG is the only one objective measurement of the retinal function. So if the system allows me to do objective measurement of retinal functions in an easy way, then it would be good for my practice.
Well, in your opinion, how does the RETeval represent the evolution of ERG?
It's revolutionary because it's simple. It allows me to perform the ERG wherever I go with the machine, and I don't have to run big protocols. I have to know his limitations, and I have to know what it's for, but it allows me to do a more simple test. When test is too complicated, it's difficult for me to perform and to teach and to find people with expertise to analyze the data. If the system comes with a simplified procedure, then it's easy for me to use it.
And is there anything else that makes this revolutionary?
Yes, they have a good skin electrode. They have a good system for doing the ERG with small pupil, and they have a very solid normal database.
Finally, why is this change in approach to ERG testing so important?
It is important because so far the ERG has been very difficult to be performed. It's amount of long training and a long studies to understand the ERGs and to perform it. And they invested in a way of simplifying the test for it to be more available for people that are not the experts in the electrophysiology. In this way, simplifying the test should be a good way to turn it more accessible.
Professor Messias, thanks so much for joining us to talk about this important topic today.
Thank you very much.